Following the confirmation of 2 imported Ebola cases in Uganda and the continued rise in cases in neighboring DR Congo, the National Task Force, chaired by the Vice President, has resolved to implement a number of measures aimed at preventing further spread of the disease into the country. Government has identified several high-risk districts that remain vulnerable to importation of Ebola cases, especially districts along the western border, refugee hosting areas and the Kampala metropolitan area. These include Kasese, Ntoroko, Bundibujo, Kabarore, Bunyangabu, Chisoro, Chikube, Kamwenge, Kampala, Obongi, Madiokolo, and others. Authorities say the new measures are intended to minimize cross-border transmission due to Uganda's proximity to the affected areas in DRC. Government has suspended all cultural celebrations and commemorations that attract large gatherings along the Uganda-DRC border. Public transport between Uganda and DRC has also been suspended for 4 weeks, including public passenger ferry services on the Semliki River. However, transportation of goods and food supplies will continue. Flights to and from DRC to Uganda have also been suspended, and the directive will take effect within 48 hours, although essential movements will be exempted. Weekly markets in border sub-counties within the high-risk districts have also been suspended for 4 weeks as government intensifies risk communication and public sensitization on infection prevention and control measures. Authorities have further directed strict enforcement of standard operating procedures in schools, prisons, hotels, places of worship, and other public spaces. Government has also enhanced death surveillance in high-risk districts along the Uganda-DRC border and Kampala. Residents have been urged to notify health authorities before any burial is conducted. To minimize illegal cross-border movement, government says it will enhance security patrols along porous border points. With schools expected to reopen for the second term, the Ministry of Health has advised schools to strictly observe Ebola prevention standard operating procedures, as earlier issued this week.
Because we know that we have been informed that in the border districts, many children come across. They cross to Uganda and study in our schools. We cannot deny those children education at this time. But what we can do is to continue give guidance to provide the SOPs and implement those SOPs.
Ministry of Health or the Uganda government has tasked the Uganda Red Cross to take lead in those areas which we normally, where we have the comparative advantage. And these include the cross-border screening at border points. We are talking of deploying our ambulances to be on standby for any identified cases, whether suspects or the real cases, to be evacuated.
Uganda has so far registered 2 imported Ebola cases linked to DRC. One of the patients has since died, while 127 contacts have since been identified and isolated.
Right now, actually, even the one who had Ebola tested negative. As I talk now, we don't have Ebola in the country. The one who's been taking care is improving and has tested negative. And soon, once she gains strength, we will be able to discharge her.
Nobat at Kunda, NTV News.